perhaps that exhibit and perhaps are victims of poor health behaviors already know this. So what are you going to do any differently? It's probably the question that every one of us is thinking. We've known this for a long time. This has been something that's out there. And what I'd like to do is share a little story, because I love stories, first of all, but also because stories give us hope. And this story, you wouldn't believe it, was actually right in this town. It was the best case study. I remember when Dr. Salman and I were talking about this, and I tell you, this is, I wouldn't call it coincidental, there's definitely some destiny in this. Because the story actually starts as a result of Public Health England rethinking some of the adoption around the flu vaccine in schools. I don't think I see Barbara here, but I see Fahad, and I remember this particular occasion. Imam Rayhan was very involved. The challenge was that children were going to school, vaccines were being rolled out, but they just weren't seeing the level of uptake that they needed to in Luton. In that particular space around this, so this was back in 2017, can you believe it? Predates all of us, predates Robin's coming as well. The numbers at that particular stage, if we look at the UK numbers, they were actually showing that the adoption of flu vaccines in schools, 53%. Now that little dark space that you see there was exactly the location you just mentioned, the Saints and the Dalla ward, that red blob there. Most people probably just call it Bury Park. Now it happened to be the subject of this study, a pilot, at a school that I happened to be a governor at, and Fahad also was a governor at that particular time, Maidenhall School, that many of us probably know. And Public Health England said, could we really turn the key in a significant way, using this as a pilot and offering something different? But before I get on to what the different was, what do you think the comparative number was? If 53% was the adoption of the flu vaccine in schools using this type of inhaler, what do you think the number was in good old Dallow and Saints Ward? Horrible numbers. 10%, 10%, wow. Against the national average, you're actually very close. It was 11%. 11%, which is part of the reason why they picked this area. Hopefully we can make a dent on that, was the hope. So what they decided to do, the intervention changed. And I think this is the key to a lot of this. We're not just talking about education and just putting the message out. That's not enough. We need to really experiment with the types of interventions and see what works. And be really experimental in this space, back it up with research, and try things. Public Health England took the initiative at that particular point. Barbara was holding the pen at that stage, and I remember Fahad was a governor at the school at that time, and involved myself and Imam Rayhan. The objective specifically of the pilot were, can we buck the trend? Can we improve the uptake just by 5 or 10%? But actually doubling the number from 11 to potentially 21%. Can we improve parental response? Because we know they're really the triggers to this, not the children making a choice, it's the parents getting involved. And can we understand the reasons for non-consent? Why aren't they taking it when they know that flu is so damaging to the educational outcomes? So this was the challenge that the pilot attempted. The intervention change was, rather than the flu vaccine being an porcine-based vaccine that was inhaled through the nose, the alternative is an injection that children would take. But we as adults don't like injections, let alone children. How do you convince a child that in fact that would be the right thing to do? And the parents as well. Now, lots of work happened. I remember there were videos done, there were messages, there was countless assemblies and conversations with parents, with the children, and with all the staff in that area. We amplified this on the radio. I remember Inspire at that time, local mosques as well, all of the attending mosques to that particular area. And the results were staggering. From 11% in 1 year, so in the first year of the pilot, did we achieve the doubling? Well, in fact, we achieved more than that. The number went up in 1 year to 25%. And even more shockingly, the year after that, up to 57%. We beat the national average in 2 years of actually communicating this to the families and saying, we understand that porcine is actually one of the key reasons why you're not taking this. But you appreciate the health benefits. If we were to provide an alternative, would you be willing to take it? And not only did the parents get behind it in the first year, but the momentum led to them driving other parents to do it in the second year. That pilot took place in Luton. We are the case study. It happened in 2017, 8 years ago. I think part of the reason why we're here and we've decided to form in this particular way is the problem isn't the fact that we're not willing to try things. The problem is the great volunteers out there, the voluntary sector, the community, the schools, everybody out there that wants to do this has got 100 other things to do. And unfortunately, they just don't have the ability to maintain the momentum. The resources aren't there. We're not able to really focus and say, what's the fulcrum here that we could change and sustain it? Sustainability is the key, not the trial itself. So what we saw as a result of this particular piece was not just improved learning, but changes in attitude and direct impact on the outcomes. So what are the goals of this particular effort? Why are we trying to do things with an alliance and hope for anything different? Well, ultimately, there's three things that we'd like to do. Number one, we have some very specific metrics around healthcare access. People ensuring that they feel comfortable, they know where to go, and they're able to access those services. Number two, ensuring that that is culturally sensitive enough. That was a beautiful example, almost day and night difference in terms of the numbers, by really honing in on what is the barrier and how can we use faith as a lever to actually change that. So thinking about inclusive practices through co-design, working with that community, listening to them, and thinking about how you do things differently. And then thirdly, putting the resources in place. Fahad and I remember the constant meetings, not just at that point, but after that point, to write it up, to share this, and voila, it actually is now rolled out nationally. Luton not only did the pilot, but Public Health England, OMID now, rolls that out nationally. So not only has this been a case study, but it's helped to start changing practice across the country. We can't do it alone. We recognize that, and that effort was a great example of it. We've got a number of members that have already signed up. It wasn't a year, by the way. I know it probably feels like that when Tayyip talks to you, but we've only been in existence for 3 months. The idea was actually, you might remember us back in the Love Luton March, the Love Luton demonstration, maybe March. That was the first time where we actually thought, let's see if we can get a little bit of feedback. And after that feedback, we thought, you know what? There's so much interest from everybody in the room today, everybody that wants to make a sustained difference, hence today's event. And our members included, and it's so great to have this, whether it's BLMK, who oftentimes in the past we think, you know what, they're under-resourced, they haven't got the capacity, but they need connections like these to make things happen. If we can facilitate that through all the partnerships in this room, what a game changer it could potentially be. Whether it's the Council of Mosques, NHS England, who are actually funding part of the research that we're actually supporting, and part of your contribution is going to be this evening, actually. And Active Luton, of course, that have signed up, and actually it's got nothing to do with me at all joining, it just happens to be coincidental. But Active Luton really getting behind this and saying, how do we use our resources and the community resources to make a difference? So the goals are quite clear, but you need a strategy that follows that up. We have a great vision, and I think this is really important. It aligns to the 2040 vision, of course, wouldn't be partners in any other way. And that vision is all about improving health outcomes for the Muslim community in particular, really focusing on the insights with them, really developing advisory groups and conversations so that we can share insights, we can share some of the resources that we have access to, and then actually publishing research to follow it up. It's actually not about the intervention at all. It's actually cementing that with quality research of a high standard that helps to change practice over decades. We didn't get here overnight, nor are we going to change things overnight. So that's our vision. How are we going to go about it? Now, in particular, there's 4 things, that's very small, I can hardly read it, but there's 4 things that we've had to think about in terms of what we can bring to the table. Number 1 is capacity. All of us are really stretched at the moment. 1 minute, that's my capacity to squeeze, yeah? So we're all stretched. How do we make things work? The synergy that comes between us in order to be able to do things differently. How do we really start changing health education? It's not enough to say, I know it. If you really knew it, then why not change? What is it? What are the barriers that are preventing that? Getting in there with the real research insights, and I'm really pleased that the university is here today. Academic partnerships like those are absolutely critical. And then thinking about, what does that last one even say? Alliances. How could I forget that one? Thinking about how we make this a true alliance. Not one of us all having our own siloed objectives, but we've actually all got the same objectives. Perhaps all we need to rethink is how we align behind the right interventions, the right research, and the right insights. So that's what we'd like to do. I'm going to hand back to Yasmin now to talk us through how you're going to make that happen practically. And don't worry, you don't have to jump up and do any exercises.
Thank you. So this part of the event is our World Cafe Insights, where we would like for you to come together and share your views, your experience, and your stories in 3 of our top issues. Can I ask the facilitators to please stand up and make yourselves visible? I'm also one of the facilitators. So we'll be focusing on 3 crucial areas that shape our well-being and our lifestyle. So we have cancer screening, facilitator Brother Rehan. We have Muslim health issues, Brother Suleiman at the back. Oh, your back, sorry. Vaccines and immunizations is Brother Suleiman, and Muslim health issues is myself. So this will form part of our strategy, a framework that will be inclusive, proactive, and community-driven. So your voices, experience, and ideas will help shape the solutions that will practically and culturally be sensitive to our communities and sustainable, and something that we as LuMHA can take on. So please go to the table that you're interested in.